Welcome to the demonstration video on costing in the TB module of the Integrated Health Tool, or IHT. This builds on previous videos that covered configuration of a projection file, adapting demographic and HIV projections, and estimating populations needing TB services. This video will cover consumable costs, program-specific health system costs, and program support costs. We will start with estimating the costs of consumables associated with delivering interventions. Total costs for each intervention are estimated by multiplying the number of people served by the cost per person served. We will focus first on how the tool calculates the number of people served, and then discuss the cost per person served. We estimate the number of people served by multiplying the target population by the population in need of services and the coverage in each year of the projection. Target populations for TB are typically drawn from the TB target population estimation step, but users also have access to outputs from the demographics and HIV components. In the Target Population Editor, there is a drop-down menu beside each intervention which shows all the available target populations. By default, the logical target population for each intervention has been selected, but this is adaptable by the user. In addition to the standardized target populations, users also have the option of direct entry, where you can put in absolute numbers for each year. Users also have the option of entering custom target populations, which are defined by age and sex. Now let's move to population in need. The population in need is the percent of the target population who should get the service. This will be 100% for most interventions in TB, since the target populations are very specific. However, population in need is still editable in case of other situations where you need to specify a subgroup of the target population receiving the intervention. Coverage is used to define the percent of the targeted population actually getting the intervention. In this example, I'm going to set the coverage target for screening among household contacts to 100% by the last year of the projection. You can enter both population in need and coverage for the first and last year of the projection. In this case, the tool will do a linear interpolation between the two data points. You can also choose to check the box at the top of the editor to show all years. In this case, you can then put in individual populations in need for each year, or individual coverage targets for each year. You can also right-click to bring up a menu that will allow you to select other interpolation options. Linear draws a straight line with equal change between each year. S-shaped assumes small increases in the early and late years with a steep increase in middle years. Exponential assumes that most progress will come at the end of the time frame, and front-loaded puts more of the change in early years. Once you have reviewed and revised the target population, population in need, and coverage as needed, you can produce estimates of numbers of people served by each intervention. You can also distribute these people across the different delivery channels where they may be reached. In the Delivery Channel Editor, you will see a row for each intervention and columns for baseline and target years. For each year, the distribution across delivery channels must sum to 100%, meaning that all people served are getting the services at some given level. You will get an error message when trying to leave this editor if you do not have a 100% distribution for all interventions. You can adjust the entries to reflect the percent of people served who are reached through each delivery channel. For example, By default, household contact screening is expected to happen 50% at the general outpatient level and 50% at the first referral level. If this should rather be 50% at the community level in your country, you can make those edits here. If there are also differences planned in the level at which services are delivered, you can represent that with different distributions in the baseline and target years. In this example, I'm assuming that there is a movement to shift more screening services to the community level, so I'm setting the delivery channel for the last year to 75% community and reducing the percent provided at general outpatient to 25%. One other point is that there are uncosted delivery channels. These include wash or water and sanitation, other non-health such as penitentiary, and private sector. They are intended to allow you to capture the coverage and the health gains for the country without including the costs of those channels. They are used to represent situations where the costs of that delivery channel are borne by an entity which is not included in the perspective for your analysis. For example, if you are taking the public provider perspective, and thus don't want to include private sector costs, you can distribute the percent of people going to the private sector to that delivery channel, so that you do indeed represent that they are getting served somewhere, but your analysis will not include these costs. Remember that if you do want to include private sector costs in your analysis, you can add private sector as a custom costed delivery channel in configuration. Putting all these data points together gives you total numbers of people served, and you can also produce numbers served at each level. As you can see, I'm moving to results, and I'm selecting the result for number of people served. If I want to narrow this to the number of people served at the general outpatient level, I can go to the cogwheel at the top right of the result and select that delivery channel. The other big piece of the intervention cost equation is the cost per person served. This is estimated based on the inputs for that intervention. This includes consumables and, depending on the use case, the estimated share of health system costs, which can be included either as shared costs of health personnel who are involved in service delivery or the cost of inpatient and outpatient services. It is worth emphasizing that since the cost of inpatient and outpatient costs typically include personnel costs, only one or the other should be included, if relevant to the use case, for the costing to avoid double counting. Inputs for interventions can be reviewed and revised in the Intervention Inputs section. When you enter that section, you can select from the drop-down to see summary table, such as the average costs of consumables for each person served, and the average personnel time needed per person served, and the average number of inpatient days or outpatient visits. If you double-click on the cell at the intersection of the delivery channel and the intervention name, you will see the details of the consumables provided. Additional tabs also show the number of minutes used to provide the service and the number of inpatient days and outpatient visits. For each consumable, there is a number of units needed, times per day, and the number of days per case. Multiplying all these together gives a number of units per case. Multiplying the units per case times the percent of people getting the service who receive that particular item and the unit price gives the average cost per case. Summing the average cost per case for all consumables gives the average cost per person served. There are default sets of consumables for each intervention. These can be adjusted by the user. You can change the percent of people getting different items on the list simply by key punching the change percent. You can also change the prices for each item by clicking on the pencil icon. If there are other consumables, for example, drugs, supplies, or other, that are needed to deliver this intervention which are not found in the default list, you can click the button to add new items and either select from the existing list or add new. In this example, I am first adding a drug from the existing list, and then I add a new drug. Once a new drug is added, you have to be sure to set the price for it, otherwise those costs will not be included. Similar to the entry tab for consumables, there are tabs for personnel time involved in intervention delivery and for inpatient and outpatient services. You can add more or different personnel types using the button to add new health providers. Once the personnel type has been selected from the list, you can identify the percent of people who are served by that cadre, as well as the number of visits and minutes at each visit which are used. In this example, I am adding a nursing professional. I am assuming that 100% of people served will be cared for by the nurse, and that it will take 5 minutes and 1 visit. The same process applies for inpatient days and outpatient visits. Users can enter the numbers of inpatient days and outpatient visits required to deliver an intervention. Users should also review and revise the percent receiving the intervention to be consistent with how the target population was configured. You can vary entries by different delivery channels. This means, for example, that you could have more inpatient days at the secondary referral level than the first-level referral delivery channel. We have now covered the 2 parts of the equation required to estimate intervention costs. We have estimated the number of people served by each intervention, and we have identified the inputs and estimated the cost per person served for each intervention. We can now proceed to results and review relevant outputs. You can see that the tool will generate results such as the numbers of people served. It will also generate results such as resource requirements like the numbers of consumables, the personnel time required, and number of inpatient days and outpatient visits required to deliver each intervention. It is important to note that the main cost category in intervention costs that is directly associated with the TB budget is the cost of consumables. You can see costs of consumables as the first entry in the cost results. We will now discuss how other intervention costs associated with the broader health system are calculated. These include personnel time, inpatient days, and outpatient visits, and when users should plan to incorporate them. In addition to the consumables costs captured, IHT also provides the option to calculate shared health system costs, which are not paid by the program. These are known as program-specific health system costs. The previous segment of this video showed how numbers of people served are calculated, and the inputs which are provided to those people, including personnel time requirements and numbers of inpatient days and outpatient visits. In order to reflect costs of these health system inputs, we need to identify their prices. You have the option to enter salaries and time utilization information for health personnel, or you can enter costs per inpatient day and outpatient visit. As mentioned earlier, if you are using costs of inpatient days and outpatient visits which include service delivery personnel costs, you should not also enter salaries and benefits for service delivery personnel, otherwise those costs will be duplicated. If you have taken the option to enter costs of inpatient days and outpatient visits, you can review and edit default unit costs for each visit or inpatient day at different levels of service delivery in the tab labeled Outpatient and Inpatient Costs. These will then be multiplied by the estimated total number of inpatient days and outpatient visits required to deliver the interventions in order to estimate the costs of inpatient days and outpatient visits associated with service delivery for your plan. In many cases, teams will accept the default data which are based on WHO choice or value TB estimates for inpatient days and outpatient visits and use them for the costing. These costs already include health personnel costs, so you do not need to enter personnel salaries in that situation. On the other hand, if you have country-specific unit costs for service delivery that do not include personnel costs, or if you only want to focus on personnel costs but not other service delivery costs, then you need to provide the information to calculate the cost per minute for each type of health personnel's time. This includes salaries and benefits, found on the first tab of the program-specific health system costs, and the hours worked per year, based on the percent of time spent on activities other than training and administrative activities, and the number of days worked per year, and hours per day. These entries are combined in order to estimate the cost per minute for the health personnel type, and then multiplied by the number of minutes needed to deliver the health intervention. Once we have attached prices to our service delivery inputs, we can see these costs by intervention in the results. As a reminder, you have already calculated the number of people served, based on the target populations, populations in need, and coverage, and you have established what each person served gets in terms of personnel time or inpatient days and outpatient visits. Putting those together gives us a total number of full-time equivalents for personnel, or total numbers of inpatient days and outpatient visits to deliver the care. Multiplying those data points with the unit prices provides the costs of these items. In the example I am showing you, you will see the costs for inpatient days and outpatient visits. The TB module of IHT also includes the option to add other program-specific health system costs such as TB equipment purchases, maintenance, and calibration costs. Purchase costs are estimated based on the cost per facility type that is being equipped and the number of facilities to be equipped. You have two options. You can either put in the estimated total costs of equipment purchase for a given facility. For example, if we estimate that each district hospital needs around $500,000 worth of TB equipment, we can select the radio button to enter the total cost directly and type that number in. Alternatively, if you have information about the individual pieces of equipment which may be purchased for each facility type, you can select the option to enter the details used to calculate the total cost. When you do this, the gear wheel to the right can be used to expand a list of each of the items anticipated to be bought for facilities of this type. You can edit this list, either zeroing out individual items, changing the prices, or adding new pieces of equipment needed. Once purchase prices have been set, you can identify the costs of maintaining and calibrating the equipment. Maintenance costs can be entered either as an absolute number in addition to the purchase costs, or they can be entered as a percentage of purchase costs. If you are entering purchase costs directly, you will enter maintenance and calibration costs on the equipment package as a whole. If you take the option to enter maintenance costs as an absolute number, they are entered simply by key punching the amount into the cells for each facility type. Alternatively, if maintenance costs are estimated as a percentage of the purchase costs, you can apply a percentage to those purchase costs. In this example, I will assume that maintenance costs are 10% of purchase costs. However, if you choose to enter details used to calculate total costs, you will need to enter maintenance and calibration costs for each piece of equipment individually. In this case, I am going to assume that maintenance costs are still 10%. But you can see that I am entering this 10% for each individual piece of equipment. I could vary these costs for each type if needed. Calibration costs are similarly estimated for each individual piece of equipment in this structure. Once you have identified the costs for individual facilities or pieces of equipment, you should move to the next tab called Facility Targets and enter the number of facilities that should be equipped in each year of the plan. Purchase costs will be incurred in the year when you specify that the facility should be equipped, and maintenance and calibration costs will be applied for that year and each subsequent year. In this example, I am assuming that we are planning to equip 5 district hospitals in the first year and 20 health centers in the following year. Program-specific health system costs also include logistics and supply chain costs. These are calculated as an additional % over and above the costs for each consumable. For example, if we are told that the costs of logistics and supply chain are 25% of purchase costs, we can enter that percentage in the logistics and supply chain editor. You can either use the same entry for all consumables, or vary by consumable. You can also enter wastage costs on this editor, assuming that a given % of consumables will be lost to wastage. Similar to logistics and supply chain, you can enter this % for each consumable and can vary by consumable if, for example, items that require cold chain storage experience higher wastage rates. For example, oxytocin requires cold chain, so I will search for it and enter 7% wastage. Once you have added information about program-specific health system costs, you can review these results, including costs of equipment purchases, maintenance and calibration, and costs for logistics and supply chain and wastage. Above service delivery program costs are estimated in IHT using an activity-based costing approach. There are a series of sections and subsections which are common to all health areas in the IHT, not just TB. These have a set of default activities under them, which can be adapted by the user to match those activities which are found in the plan under consideration. In this example, I'm going to review the activities in awareness, and specifically community-led TB and leprosy awareness and health education campaigns subsection. Using the arrow button, you can expand each section into its subsections and see the activities within the subsections. Default activities are featured in IHT as mere suggestions to prompt planning discussions. Users can delete default activities using the trash can to the far right of the screen, or add new ones using the Add New Activity button at the bottom of the screen. For each activity, you will add the inputs which are used to carry about the activity. These inputs are found in a database in configuration, where you can add to the default list, and you can put in the unit prices which are relevant for your country. You must go to configuration to add inputs, or to change prices. You cannot do this in program support costing. In this demonstration, I will now move from program costing back to configuration and to the database for the inputs. I can update my prices here. For example, I will enter an annual salary for a director. I can also add more inputs as needed, for example, a central venue for a training. For each activity, you should select those inputs which are required to carry out the activity, and specify the number of units, the duration, in the case of a training or multi-day event, and the frequency for each input. Each element requires an entry greater than 1 to have a cost for that entry. You can add an input to an activity using the Add Cost Inputs button at the bottom of the screen. One simple example might be National TB Program staff salaries. In this example, we look at a grants coordinator. Their salary is entered as an annual salary. As such, we would enter a number of units of 1. If the entry was for a monthly salary, for example like this manager, this would imply 12 units to cover all months. The duration would be 1 for full-time staff, and the frequency would represent the number of people of that type employed in a given year, 1 grants coordinator in this example. I will now do an example of a 3-day training of 30 participants, which occurs 1 time in 2025 and 2 times a year thereafter. I'll start by adding all the cost inputs that I need for this 3-day training activity. First, I make sure that I am adding my costs under the training activity. Now I select the cost inputs that I need. These are training, per diem, training, venue, large room, training, refreshment, training, material. For this 3-day training of 30 participants, I will include 30 units and a duration of 3 days. I need the venue for 3 days. I also need refreshments for 30 people, which I enter as the number of units. For 3 days, which is the duration. I need 1 pack of training materials for each of the 30 participants. This is entered as 30 units and a duration of 1. Since it does not need to be replaced each day, duration is irrelevant. The frequency represents the number of times each year that the event takes place. In this case, this is 1 training in 2025 and 2 from 2026 onward. Remember that costs are drawn from the activity input database in configuration. Costs cannot be edited in this editor. This ensures that the same price for each input is used throughout costing of the plan. You can also add custom sections and subsections to a projection, which could represent the strategic objectives of the NSP, or other ways that you might organize program support activities. Once you have entered the activities and their inputs and costs, you can review the costs for program support. The table will be generated at the section level. You can also configure the result to show costs by subsections, activities, and cost categories. This concludes the video demonstration on how to use the costing component of the TB module of the Integrated Health tool. If you have any questions or concerns, please be in touch using the Contact Us button at the bottom right of the screen in the tool.